Hi, I'm Christian Sinclair. I am one of the members of the Roundtable on Quality Care for People with Serious Illness. I'm a physician and I represent the American Academy of Hospice and Palliative Medicine. I'm here with Dr. Vicki Jackson Hi, Vicki. It's good to see you.
Good to see you.
She's a doctor at Mass General Hospital and just got done speaking about how hospitals work with insurance companies to better care for people with serious illness. Tell me a little bit about how you make that happen.
Yeah, so I was speaking with Anna Goslin, who is a leader at Blue Cross Blue Shield in Massachusetts, and we really have worked hard to think about alternative payment models and to think about ways in which shared savings benefits could be invested in different programs. And at MGH and on the partners level, which is our health system, we've been able to use some of that shared savings to fund a variety of different things. One is a primary palliative care work in a serious illness conversation. Another piece that I spoke about today was a home-based palliative care program, which has been great, and it really tries to meet the needs of those patients who are kind of, they're too sick to be engaged in longitudinal medical care, but not sick enough for hospice. And so we've been able to show that there's cost savings with this nurse practitioner, physician, social work model. And what's great about working with the payers is, Anna and her team, they really want to just improve care for seriously ill patients. So we think together about what are ways that we can work together, in being able to deliver this care and being able to leverage the payer and what we're doing in the health system.
And so this, hospital system or health systems working with insurance companies together, how is this different than maybe we were looking at these problems 5 or 10 years ago? And maybe what do you see happening in 5 or 10 years in the future?
Yeah, it's interesting. So I feel like what my experience of it has been is that there's just much more of a collaborative relationship. So I'm understanding, we spend a lot of time talking together about what are they interested in, what issues are they how are they trying to drive change? They want to know from me, what does the landscape actually look like? What am I struggling with? Which I think 5 or 10 years ago didn't happen in quite the same way. And it allows us to be able to, I think, be much more effective in the way we're designing these programs because they're really listening. My sense is moving forward is that there are even more opportunities. So for example, Anne and I were talking today, Sean Morrison mentioned that there aren't any patient-reported outcomes in this space of home-based palliative care. And she and I were talking, are there ways that we could think about working on a project together to try to improve data in that space, which I think that's a great opportunity that I don't know happened 5 or 10 years ago.
Good. Well, very good. Well, thanks for coming to Washington, D.C. from Boston. And
my pleasure.
We hope that you continue to tune into the National Academies of Sciences, Engineering, and Medicine programs like the Roundtable and all the work that this group will do. So thank you very much.
Great. Thank you.